I'm Dr. Ryan Stanton, and it's time to find out what's going around. Cancer is one of the biggest health issues impacting Americans, and it can hit at any age. The CDC reports about 1.7 million new cases of cancer each year and about 600,000 deaths. I've always felt that cancer is the scourge of current generations and something we see often in the emergency department, not just from complications, but also for new diagnoses. Cancer is basically normal tissue that has lost autoregulation. Our body and cells do a great job at regulating, knowing when to grow, replace, but more importantly, knowing when to stop growing and multiplying. Cancer is this loss of the off switch for the cells. It's a mutation that allows cells to grow and reproduce without restraint. The type of cancer is determined by the cell source that has lost the regulation. Skin cancer is by far the highest in terms of incidence, but not often counted with statistics. As for higher risks of cancers, prostate is number 1 for men, breast is number 1 for women, and lung cancer is the number 1 cancer killer for men and women. Over the past 20 years, the cancer rate has slowly dropped, but one that continues to grow is pancreatic cancer, which is one of the most deadly and hardest to find early. Aretha Franklin recently passed away from a lengthy fight with pancreatic cancer. The challenge is that the majority of cancer cases are random mutations and not related to genetics. They are also difficult to detect, often asymptomatic until they are advanced in size and severity. Treatments are advancing and more people are surviving the diagnosis, but it still will impact millions every year. The best approach is early detection and prevention. Annual visits with your primary care physician and participating in all age and gender appropriate screenings can help detect early cancer. Also, pursue new symptoms, especially if you have a high-risk exposure, such as smoking, extensive tanning, hepatitis, human papillomavirus, or certain workplace exposures. We can make steps, but we want to do everything we can to prevent, detect, and treat these terrible diseases. You can join the conversation on the What's Going Around Facebook page and at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and that's What's Going Around.